Darren Jones is with us. Hi, it's good to see you. Thanks
Morning.
for joining us on the programme this morning. 10 senior Tory MPs have written to the PM saying the case for an immediate ceasefire is unanswerable here as far as Israel-Hamas is concerned. Do you agree?
Yes, we want to get to a position where a long-lasting ceasefire can be in place because, of course, you want to get back to a political dialogue about securing a two-state solution. But ceasefires only happen because the people fighting each other agree to it, and that's why the diplomatic efforts are so important in trying to secure that outcome.
We're told by some organisations that Gaza is on the verge of famine. We need to do something.
Absolutely. That's why the aid and the availability and access of aid has been as important a part of the conversation as the release of hostages and trying to get to a position of peace from the very beginning. That's why the UK and our allies have been making that case, trying to work with Egypt and other partners in the region to get aid into the area and to get people to a position of safety. This is one of the inevitable tragedies of a war like this, and that's why the sooner we get to a position of peace, the better.
Not my words, the MP's words, the 10 senior Tory MPs, brutalisation of the civilian Palestinian population. Yesterday, the main man for the Catholic Church in England was sat where you are.
Absolutely.
And he was saying that as far as he was concerned, the Israeli Defence Force was responsible for the deaths of 2 churchgoers.
Well, look, in war, there's always one side responsible for the consequences of their actions, and all of us will have a common sense of humanity in wanting this fighting to stop. Of course we do, but you've got to persuade both sides to get to that position, and there's a whole number of things that need to happen, which is why we welcomed the long humanitarian pause that started that process of hostages being released and more aid being made available into Gaza, but clearly there's much more that needs to be done.
Yeah, but it's gone too far now, is what you're saying.
All war has gone too far. When a war has started, you never want to end up in a position of war in any circumstance. It's definitely gone too far at that point. Diplomacy and politics has failed when war starts in any situation. And the longer it goes on, the more tragic it is, and the more impetus needs to be behind trying to end it and get to that position of peace that everyone wants.
Talk to me about the magnificent Esther Ranson. You've seen her picture on so many of the front pages this morning. She feels that she might have no choice but to go to Dignitas because she cannot end her life here in the UK legally, and she's worried about taking a family member with her to hold her hands during her last breath because they could face 14 years in prison when they come back to the UK. What needs to be done about that?
Well, the law was written, I think, in the 1960s around what's referred to as assisted dying, where people go with somebody that ends their own lives in those circumstances. If that's to be updated, then it needs to go through a process in Parliament, and it's one of these issues that we call kind of conscience vote issues. It's not a party political issue, but that requires a fairly lengthy process to start where, for example, a committee will take evidence, the House gets to debate it, you'd want to know how the law might be drafted, what the checks and balances are, the scope of it, what the review periods are. There's quite a lot of detail around these types of votes because they are really, really important and very sensitive issues. And so before you would even get to a position on voting on anything, there's a process that Parliament would need to go through that hasn't started in Parliament. So if we
should it?
Well, I think clearly there's a demand from the public to have this debate. And if the public want to have a debate on an issue like this, the House of Commons is there to serve the public, and so it should be debated. Yes.
What does your conscience tell you should happen?
Do you know, Kay, MPs have their own personal views, and they also represent their constituents. And I was asked in another interview this morning how I would vote on a piece of hypothetical legislation, and I wouldn't say how I was going to vote, not because I'm sitting on the fence or hiding anything, but because on an issue as sensitive as this, it's my duty to talk to my constituents, to consider the detail when it's published by whoever is in government at that time, and to take a very careful and considered view. And what I don't want to do is preempt a debate, which I think is going to happen probably sooner rather than later in our political system, by taking a view at this stage before I've had that chance to talk to constituents and look at any detail.
But if you were my MP, I would want to know what your conscience is telling you.
Yeah, and if you were my constituent, I would have those opportunities to talk to you locally.
So you do have a view, you just don't want to share
about it. No, when you talk to your constituents, it's not about telling them what your view is, it's about listening to them. And the best way to do that is that when you have the detail, you can put it in front of everybody, look at it and have a conversation based on its merits.
When you vote in the House of Commons, surely you vote with your own conscience. That's what you were saying. You don't vote specifically on what your constituents are telling you to vote on.
Oh, no, well, greater people than I have said, and you will know, you're representing your constituents, you're representing the country, and you're representing your party when you vote on things in the House of Commons. And most votes week in, week out are not particularly controversial, but where there are votes that are sensitive and where people have maybe deeply held views, you've got to balance those competing priorities. And any good constituency MP will engage with their constituents and take the opportunity to listen to them before coming to a view. And you have to take a view and then you have to explain how you came to that view.
I understand that, but it cannot be right that if I decided that I wanted to go to Dignitas and my son went with me, that he could face 14 years in jail when he came back. That cannot be right.
So I agree with you on that point. And look, when the Crown Prosecution Service, I understand when Keir Starmer was running it, said that cases where there is a clear sense of compassion will not be prosecuted in the public interest, only where there's a case of vested interest or kind of malpractice. And so the system as it is today kind of allows for that to happen, but it's not designed in the right way because the law is very out of date, which is why I think this debate is important. All I'm saying is you have to do these types of things very carefully and sensibly.
Can we agree that the law needs to be updated?
I think the law should be updated. If it was last written in the 1960s, we should be talking about that in the context of our modern society and thinking about what we want to do.
OK. While we're talking about doctors, I read in The Guardian today. Yeah, have a good sip of your tea.
Sorry, thank you.
No, not at all. That's what it's there for. And I'm reading that a Labour government would treat increasing the pay of junior doctors as a journey, not an event. What does that mean?
Well, it means that obviously the pay dispute needs to be settled. We would rather the Conservatives in government did that now because we want to get all of those doctors back doing the jobs that they've trained and worked so hard to do. But evidently, there's always a trade-off between the things you would like to do and the things you can afford to do. I know that only too well, being a member of the Shadow Treasury team. And the economy is in a really bad position. We have lots of plans to get the economy growing, to reform our public services, to deal with waste.
So the bottom line is they're not going to get their 35%, are they?
I think where Street in is that the Shadow Health Secretary has been very clear that we can't afford a 35% pay rise at this time, and that's probably what that language is referring to. But we have to be successful in growing the economy, reforming our public services and ending the huge amounts of waste in government that we've seen under the Conservatives so that there's more money available for
How are we all going to fix our teeth?
Well, we've got a dentistry recovery plan, which we're announcing today, which has a number of things in it. We've said that we'll fund 700,000 additional urgent NHS appointments across the country because we know many people can't get an NHS appointment. We've said that we'll incentivise newly qualified dentists to set up their practice in areas where there are no or little NHS dentists in that community and require them to stay there for a number of years in return for that incentive payment. We've said we're going to bring back the supervised toothbrushing scheme in schools that mean that children learn from an early age good oral hygiene to prevent them getting bad teeth in the first place. And of course, we've got to deal with the NHS dentistry contract, which is the fundamental problem that's preventing dentists from doing more NHS work in the course of a year for patients who need it.
Should Michelle Mone be kicked out of the House of Lords?
Yes, I think she probably should. She's admitted, well, she probably hasn't, she probably wouldn't say she admitted to wrongdoing, but it sounded like wrongdoing to me from the interview over the weekend. We've had a number of cases in the House of Lords where peers have broken the law or acted unethically.
We can't say she's broken the law yet. I think I'm right.
No. I'm saying other peers have broken the law. Yeah, sure. Thank you for my benefit there. Other peers have broken the law in the past. House of Lords has updated some of their schemes, but I don't think it's quite as robust as we have in the House of Commons with the Standards Commissioner and the right to lose your job as a consequence of bad behaviour. And that's
but bye-bye Baroness Mone, as far as you're concerned.
Well, look, clearly there's more to this story to come out. I mean, we've seen the front pages this morning, about what ministers knew what, about the lengths of contracts, the amounts of awards, the kind of special treatment. That's what she's claiming. That's why we in the Labour Party have said there needs to be an independent investigation of the conduct of Conservative ministers and how we ended up in this situation in the first place. We shouldn't really be having this slanging match through the media between Conservative peers and Conservative ministers. We should really get to the truth And as Rachel Reeves, my boss, has clearly pointed out, appoint a COVID commissioner so we can get back our money from people that took it away from us illegitimately during the COVID pandemic.
How's the tea?
It's coffee, actually, and it's very welcome because I didn't get much sleep last night.
Oh, OK. Well,
my kids are here, so it's keeping me going.
You're very welcome.
Thank
Merry
you so
Christmas.
much. And to you.
They still believe in Father Christmas, obviously.
Well, why wouldn't they?
Exactly. How old are they?
6, 4 and 4 months.
Oh, congratulations.
Thank you.
No wonder you don't get much sleep.
It was the 4-year-old. She had a bad cough and she was coughing until about 5:15 this morning.
And
went
you were
to
up
sleep,
at 5:20.
and then 5:30 my alarm to come and talk to you and others.
There we go. It's good to see you. Enjoy the coffee.
Thanks for having
Thanks
me.
very much indeed. Thank you.